This is a 54-year-old male who came to the ER with chief complaints of generalized weakness, nausea, and an overall sense of illness, which we believe is fatigue. The reason the patient came in today is because the symptoms had progressed over the past 2 to 3 days. Patient is lethargic and unable to answer full questions on the history and any more information on the chief complaint. His active medical problems include longstanding diabetes and uncontrolled hypertension. Medications include sulfonylurea, diuretic, and an ACE inhibitor with unknown names and dosages. Unable to receive any other information on the patient's history and review of system because of the altered mental status. EKG was positive for ST depression and left bundle branch block, and also suspicion of hyperkalemia. The patient is lethargic and ill looking. Temperature is 36 degrees Celsius. Heart rate is 70. Systolic blood pressure 154/105. Respiratory rate is 22. Pertinent positives on the exam consist of moderate JVD, an S4, minor bibasilar rales, hypoactive bowel tones, bilateral pitting edema to the knees, and on neurologic exam, the patient is moaning and is oriented to only person and place. The patient does not have a murmur or rub, does have a regular rhythm, and no respiratory distress. Abdomen is soft and untender, no organomegaly, moist mucous membranes, and skin is cool and dry. In summary, the patient's major presenting problem of nausea, weakness, and overall illness also presents with fluid overload as evidence of edema, rales, JVD, and an S4. Patient also does have hyperkalemia on the EKG. The differential diagnosis includes hyperkalemia, acute on chronic kidney disease versus just acute kidney injury, and CHF. The most likely diagnosis is acute on chronic kidney disease because of the hyperkalemia, fluid overload, and long-standing history of uncontrolled diabetes and hypertension. The plan is to admit to the ICU with strict intake and output. We'll discontinue diuretics and ACE inhibitors, pending x-rays, lab results, and UA culture, pending a 2D echo, and pending a bilateral lower leg duplex. Will administer 10% calcium gluconate, 10 units of insulin, and D50 for hyperkalemia. Will recheck, continue cardiac monitoring, and check for hypoglycemia. Will reevaluate as tests become available.